Well, the idea of profit over health is being challenged by academics and researchers around the world. Recently published Lancet research shows that 4 industries, unhealthy processed food and drinks, fossil fuels, alcohol and tobacco, all account for around 19 million deaths annually. Now, added to this, the commercial sector uses various targeted marketing strategies to entice consumers to buy unhealthy products. Now, Dr. Teurai Rwafa from the Wits School of Public Health joins us now to discuss her article about how global industries make people sick. And Doc, thank you so much for your time and good morning to you. Now, how did this study come about?
Thank you for having me. I think generally globally what we're seeing is there's evidence that the number of non-communicable diseases is increasing and even surpassing like our common HIV epidemic. So you realize that it's because of what we are consuming that the general public is suffering from non-communicable diseases, including air pollution as well. And also now talking about environmental crisis or the global crisis that we're seeing due to extractive industries extracting fossil fuels that are actually damaging the environment, thereby affecting our health.
With that being said, I mean, what are some of the driving factors then of profit over health?
So really the driving factor is profit itself, because we realize that corporate nationals, what they're interested in is profit versus our health. So you realize that global, public health practitioners are on one end of the spectrum where they're looking after people's health, while commercial actors, what they are gunning for is just making profits, disregarding our well-being as well as our health. Hence, they employ various strategies or tactics that they use to get us to consume more of the unhealthy products that they are producing. For example, you realize that big companies, those that process ultra-processed foods and sugar-sweetened beverages, they continue to have advertising during family prime time. More than half of those adverts are on ultra-processed foods and sugar-sweetened beverages. So we have these adverts bombarding us. Even on our way to work and schools, we've got big billboards and adverts are just on our streets, and we can't really get away from that. But their strategy is just to drive us to consume more of these unhealthy products which have no nutritional value, but just full of sugar, salt, as well as fat.
Dr. Rwafa, is that what you refer to when we talk of dark marketing strategies? That it seems that there's a psychological, implications in what we see over and over again at specific times. What we consume, of course, visually, that driving us to buy, to pay our money, consume all these products that are essentially deadly.
Yes, of course, it's a system that has been created in place. So many a time we think that we have got a choice. Initially, what we're really running away from now is trying to con overweight or obesity as disease of the lifestyle, because we make it as if we are blaming the individual for the choices that they are making. But if that is what the system is producing, if the system is offering you unhealthy food at a cheaper price, so it has been made that way that the default system is for you to just go and purchase something that is more affordable and cheaper, and usually these are your things like your slab chips that will be cheaper than healthier food. So the system has been designed in such a way that our default is really they are making a healthier choice, not the easy choice, which is what we are trying to raise awareness on.
And what are the consequences? I think so that those who are actually looking at this conversation and listening in can understand what's at stake here, essentially, which from my understanding is one's life and also one's health. But in your research, what are the consequences?
The consequences, sadly, we're seeing a lot numbers of high preventable deaths. For example, globally, we realize that processed food, alcohol, tobacco, as well as fossil, these big industries, what they do, not just the unhealthy products that they produce, but also the practice that they use to get us there or to even produce these things are costing the world 19 million preventable deaths. And that's a lot of deaths. And on top of that, there's a rising number of sicknesses on non-communicable disease like obesity that are on the rise, as well as it's also causing a lot of injuries, and it's also costing our economy as well, because it is us, the individuals, the families, as well as civil society and governments who then tend to bear the cost of harm that big industries are causing on our health and well-being.
In your opinion, what action do you think needs to be taken now?
I'm happy because we're beginning to have these conversations. Social mobilization is one of those actions that are needed. Just get people seated on a table and talking about these issues and how big corporates are gaining profits at the cost of our health. And as well, also need stricter marketing regulations, especially those that of advertising of unhealthy foods to children. That is needed. And also, I think international conventions of food, because we've seen that there's been stricter penalties when it comes to tobacco, for example. Don't see it's advertising on TV. And if you were to follow the same in terms of alcohol, in terms of ultra-processed foods, as well as fossil fuels, because these big industries, their strategies are the same and they use the same playbook to players, if I can put it in that way.
Yeah. What role, also in my last question to you, do you think government can play in as far as, driving and influencing on policy, for policy changes?
Government can also play in terms of, so one of the strategies that big corporate use is they really try to evade tax and pay less tax than they should. So if government can just make stricter regulations upon that, as well as also the food and environments that we're growing in, and also in terms of urbanization, you realize that there's a school here and there's a fast food outlet next door in terms of urbanization and how urban planning is being planned. So they can play a role in that. But one tactic that corporate nationals use is there's really less law enforcement for them in low and middle income countries, as they are using us as growing markets. So that is when the government needs to come in.
Well, I appreciate you speaking to me about this. Dr. Teurai Rwafa from the Wits School of Public Health joining us, of course, this morning on this very important matter pertaining to our lives and our health. Profit versus health. 4 ways big global industries actually make people sick. 19 million people around the world dying. Preventable deaths, that is, due to processed food and drinks, unhealthy food, tobacco, alcohol, and that, of course, accounting to the number of deaths we are seeing.